Great evening, everyone, and welcome to Moments of Motivation with Michelle. Thank you for clicking and joining us this evening. I asked you before we get started if you would please like, tag, and share this broadcast. And then also ask you if you would take the time to go over to YouTube and like and subscribe to my YouTube channel, Moments of Motivation with Michelle. Again, thank you for joining us. Please like, tag, and share this broadcast and take the time to go to my YouTube channel, Moments of Motivation with Michelle, and share and subscribe to my page. This evening, I am so excited to sit down and have a conversation with this beautiful young lady named Angelica Spencer. Did I pronounce your name correctly?
It's okay. Angelique is
Angelica.
fine.
What is it?
Angelique.
Angelique, excuse me, Angelique Spencer. We're going to discuss what Angela is doing as a nurse, some of her background, and also we're going to talk about this coronavirus, the COVID-19, and also we're going to talk about the vaccine. So thank you for joining us, Angelique. And I ask you guys to please welcome her to our segment for tonight. If you would like to, you're more than welcome to comment. In the comment section. When we see your comments after we finish at certain points, we will allow those questions to be asked. So please stay with us as we share with Miss Angelique Spencer. How you doing tonight, Angelique?
I'm doing well. What about yourself, Miss
I'm,
Michelle?
I'm doing great, girl. Just finished playing volleyball in my backyard. I'm about to burn up, of course. Hot, hot, hot. Had a house full of kids. Let me see. There were three people on my team, three on the other team. Well, they had four, so they had to rotate in and out, and had to rotate somebody in and out.
That sounds like fun.
And we got to do a tiebreaker because they won and we won, so we got to come back together so we can play again.
Nothing wrong with a little bit of activity outside.
Yes, ma'am. Wonderful to be with family, and we were
That's
social
right.
distancing as much as we possibly could. So again, Angela, thank you for joining us, and tell us a little bit about who you are, where you come from, and what you do.
Sure. I was born and raised in the awesome little small town of Rockingham, North Carolina, in Richmond County. Go Raiders.
Go Raiders.
Graduated with the class of 2003, Richmond Senior High. From there, I attended nursing school at North Carolina Central University and gained my master's of nursing at Grand Canyon University.
So
I've
you
been a
have
nurse for about I've been a
awesome.
nurse for about 12 years. For the last 10 of the 12 of that, I've been in management in the hospital system and home infusion and home health services.
Okay, so Angela, what made you choose or decide to become a nurse? Is that a calling? Something tap you on your shoulder and say, Angela?
Well, my mother could tell you, believe it or not, I had the first book published by Ben Carson. That was his first book published, rather, when I was younger. And I always wanted to be a neurosurgeon. So I started out with biology, pre-med major, and just coming through some of the courses, I started falling in love with nursing. And I was like, okay, this is actually not too bad. You know, you get a different feel for bedside when you're a nurse versus being a physician. You know,
Wow.
everything is a little bit more rushed. You don't get that intimate time with your patients. So I started falling in love with it, and I just kept from there. And I said, okay, let's see where this goes. And I've been in it ever since.
So you say you are from Richmond County,
Yes,
the
ma'am.
home of the Richmond Raiders.
Yes, ma'am.
Were you involved in any sports? Were you a cheerleader or anything like that?
Yes, I joined the National Guard the summer of 11th grade. So I also was prior service battalion commander in JROTC, drill sergeant there. Little bit of everything going through school, drama clubs, Spanish clubs, basic stuff like that kids do in high school. But my love was always the nursing program they had there at the school, as well as ROTC. So I stayed sheltered with a lot of that. And that's what I did on the weekends if we didn't have drill for the National Guard.
So did I understand you right? Did you say you were in the military?
I joined the National Guard while I was in high school when I turned 17.
Okay, well, thank you for
Yes,
your
ma'am.
service, Angelique. Man, you've just been a caring professional all your life. Where
It
did you
helps
get?
when you have those parents that's driven. They drive you in that right direction.
Right, right. That is so awesome. Thank you for all that you do. And we know that you have been on both sides of this battle
Yes,
of
ma'am.
this coronavirus. And I would like to say personally to you, to your colleagues, and to the rest of the nurses and care professionals, or the first responders. Some people call them warriors,
Mhm.
heroes. Thank you guys for all that you do to keep us safe, protected, and taken care of. I know that it's hard. It's not I mean, it's difficult, and it's been a lot. So let's see, where should we start at? Let's talk about, you say you work at which hospital?
Through UNC Rex and Landmark. Mhm.
USC Rex. Were your numbers high there?
Um, for us being in some big areas, rich in Durham counties, Orange counties, Chapel Hill, and such, Wake County, we did have some big numbers.
So tell
Uh,
us, where were you at when you found out about the coronavirus?
Honestly, it started to trickle down when a lot of patients were having upper respiratory issues, and your general round of steroids, antibiotics just weren't cutting it. Generally, everybody loves a good old CPAC or a Z-Pack, rather, is what they may call it. And normally that just kind of knocks it out, or 7 or 10 day course of a small antibiotic. Well, a lot of these people didn't get better, but people just felt like, okay, maybe they're used to having Z-Packs each year during this time of year. They're used to having upper respiratory infections. Give it some time, maybe it'll run its course. Well, throughout that time, a lot of people didn't even know they probably had COVID with the same symptoms. Around last January, February is when a lot of people start having some of these symptoms, and not until diagnosis coming down around the beginning of March is when we really start seeing it here.
So I know a lot of people in my area, sometime around October, November of the prior year, were saying that they were, definitely ill, having something that was way beyond a common
Yep.
cold, the pneumonia. They didn't know what it was. They felt
Mhm.
like, and the majority of them say they felt like they were dying.
Mhm.
And so after the coronavirus came out, the comments were, I believe I had the coronavirus, that
That's
it
correct.
just went undiagnosed. And, uh, did you all have a lot of that going on in your hospital as well?
We did. A lot of people, unless they really were ill, chose more of their PCP or their urgent cares. So that's when a lot of the urgent cares started to get busy. But because of it being in the wintertime, it's not uncommon for flu season and such to have a lot of people, in and out of those facilities. The only piece is because that test was not in existence then, really wasn't a way to tell. They also didn't really start antibodies testing publicly for a while. By then, most people who would have had antibodies that would have built up would have dissipated over that time frame, because most antibodies only last about 90 days or less if you develop antibodies.
Okay. So tell us again, and I know that, we know a lot about the coronavirus and COVID-19, but tell us, those that are viewing today, tell us, what are some of the signs and symptoms of the coronavirus?
For a lot of people, it may start as a simple cold, runny nose, or feeling of flu symptoms. Generally, with cold, you can hydrate well, take some over the counter medication, and you start to feel some improvement. For those with COVID, it gradually progresses in other ways as time goes by. It may start as a cold, day 4 of symptoms, and then by the time day 7, you may have fever, chills, body aches. A good bit of people develop bronchitis, some going into pneumonia as well with it. So it starts off with a lot of flu-like symptoms. Some people, on the other hand, are a little bit different. Since COVID is so broad, they may have only had a persistent headache, or noticed that their food just started tasting a little different. Oh, it's having a little metallic taste or a burn taste all the time, or it's a loss of smell. So it can actually be shown in several different ways.
There's one comment that you just made that I
Mhm.
want to see if you would, give us a little bit more on. When you
Sure.
said that it's so broad, what do you mean by that? Because a lot of times you hear people say it's broad, or
That's
you'll
right.
hear people say that the arms of COVID are very long. So explain
It
that to me.
is. It is. Generally, when you're looking at something, say for instance, the flu, it has a general set of symptoms: your fever, fatigue, sometimes body aches, chills, things like that. The same cluster of symptoms. So it's normally easy to figure out what it is, even without a test. A lot of times, even without flu tests being present in your PCP or your urgent care, they will go ahead and give you the medication for the flu because it has those same generic clusters of symptoms. With COVID, it's been so widespread from those being asymptomatic, even though they tested positive, those, like I said, simply just having a headache. Some only had bowel issues, diarrhea. So it was very hard for the healthcare system to try and pinpoint when individuals would have COVID. Even I myself being sick and contracting COVID last July, I never developed a fever. So you can't base it off of, okay, I don't have a fever, I shouldn't have COVID. I don't have chills or body aches, I don't have COVID. It's so widespread. So what they try to do is get a good history of whom you've been around, if you develop certain symptoms, if you go in, basically do your normal check, your infectious symptoms, your fever, your chills, diarrhea issues, those there. And if you go beyond that and say, yes, I do have those, they'll continue to go down. Let's see what else you've had in the last 7 to 10 days. Let's see. And that's how they develop the symptoms that are placed on the CDC websites, Institute of Health. That's actually how they get those symptoms. It's not just, this is cut and dry, this is the symptom you're going to have. They do it based off of people who have tested positive and the symptoms they report, and they take that as a collective. And the more and more people who report those common symptoms, they find that they're not so rare. A lot of people had it, but they didn't connect the dots together with COVID.
Okay. So being a nurse and being on the other end, other side of this, when you found out that you had COVID, what did that do for you?
It was a hard spot. I kind of felt like, okay, I preach every day to people, wear your mask, hand wash. I feel like I was doing, all those things, and here I go and I get it. It was also disheartening, learning you're passing it to your toddlers, worrying about if you're going to pass it to other family members. When it's your colleagues, it's a little different because we take those mandatory precautions, mask, gown, everything there. But when it's your family or your friends or anybody that you've been around, you take it personally because you never know anybody's background that may just turn into a catastrophe of symptoms and ultimately could be a critical illness or their death if they get it.
Right. We were out doing a free mask drive not long ago in Richmond County, Hope County, and Scotland County. And a lot of parents were asking us if they were supposed to give masks to their little children, toddlers. And so I would like for you to share with us, a lot of times we've heard that children can get COVID. We've heard that children can get COVID. Can infants, can toddlers, can they contract COVID?
Any child can technically contract COVID. It seems to be more prevalent in the middle school and above age. Those that are younger can still contract COVID, but they don't always display symptoms. Transparent moment, my 2 and 3-year-old at the time actually didn't have any symptoms but a mild cold, only my son. So you would have never known he had it. Some of those things, as far as the younger kids being asymptomatic, does help in lessening the transmission rate. So that's why a lot of schools decided to say, hey, K through 3 may go back to school in person, and the older kids who are more likely to spread those germs around and move around a little bit more, those are the ones they decided to keep home virtually. The goal right now for CDC is 2 or older. I still see a lot of kids that are 4 and 5 who do not wear masks. It's something that, we just kind of have to guide in with our kids, remind them in their own technical terms, germs, icky, different things. We say things like that. And if we get them accustomed to it, they'll eventually be ready to go to a school setting with it where it's required. That's also where we kind of just make sure we're interjecting hand washing all the time, touching your face often, some of those ways that it's easily spread. So the guidance is 2 or above. Anything younger has suffocation issues or possibilities with that. That's, infants are a big population. They have smaller breathing passages. So it's been transmitted to a good deal of infants. And that's one of the side effects they've had with COVID in that population is difficulty breathing. Having a lot of mucus is one of the big side effects of COVID. So that's one of the things you don't want to see a 6-month-old have to endure and build fevers from that.
Right. So protect your children as well. Wash
Mhm.
their hands.
Mhm.
Make sure that they wear masks, and keep them away from a lot of people, especially people who are, like you said, sick or asymptomatic.
Mhm.
Asymptomatic. You use that terminology, and a lot of people, they didn't understand what it meant to be asymptomatic. Can you please explain that?
Sure. Asymptomatic is simply stating you're not displaying any symptoms. So although you may test positive, you may not have any symptoms whatsoever, fever, chills. You may just feel perfectly fine. There are people every day who are walking around with COVID who have tested positive that are like this. For some, we just can't pick and choose. Some people, their bodies just reacted differently to it, and unless they were tested, just by chance of exposure, just by chance from their job, just as a requirement for job onboarding, they would never know they even had it.
So, do you see, because the numbers seem to be decreasing, that people are becoming real relaxed now with, going out, the social distancing, not wearing masks as much, washing hands? Do you see where people are being too relaxed? And if so, what would you suggest or recommend?
Don't let your guard down. A lot of people have the same notion as they did last summer. Oh, COVID does not do well in the heat, so it's starting to get
Right,
hot outside. So let's, just as long as we're outside in the heat, it doesn't matter if we're socially distancing outside. It doesn't matter if we have masks on. Don't let your guard down. There are a lot of vacations going on, spring breaks going on right now. We're no longer in the red for about 90% of our counties in North Carolina, but we still are in the orange for a good bit of them.
mhm,
And that number could shift at any point in time. Since the vaccines have started, we have seen a significant decrease in deaths, but still a substantial amount of positive cases. So it's a benefit in itself, but we still would like to see less cases as well. But we just still have to do our part. Wear a mask. If you are one of those people who decided to get one of the three vaccines, it is great. It will help, build your immunity as far as transmission to others and from others. But if you are around people who have not had the vaccine, you still want to practice those same guidelines.
right.
6 feet, wearing mask. The only time right now the CDC is suggesting is if it's amongst small groups of people who have been vaccinated, then you're able to take your mask off and still gather in small groups safely.
Okay. So now that you're talking about the vaccine, let's stay in that area.
Okay.
We have a lot of communities, and I'm not going to just say African American
Sure.
communities because I'm around a lot of people,
Mhm.
and a lot of people from different communities, Caucasians,
Mhm.
Hispanics, African Americans, whoever, have their doubts. There's a stigma, suspicions,
Sure.
fears, as it relates to being vaccinated. A lot of people want to know, which one should I take? Should I take the one
Mhm.
shot? Should I take the Moderna? Should I take the Pfizer? So what? Well, I'm not going to say what do you recommend. Let's talk a little bit more
Sure.
about, the vaccines. Can you give us some information about each one of those, and
Sure.
then give us, some recommendations?
Sure. The area we reside in primarily, they're distributing Pfizer, Moderna, and your Janssen, which is produced by Johnson and Johnson
Okay.
company. And with those three, Pfizer and Moderna are two-shot series. So the first shot gives you between 40 and 50% immunity. So it does start to build about 10 to 12 days after your first shot. But essentially, you're coming right on the other end of the curve. So the two shots are normally given about 21 days to 4 weeks, to 4 weeks apart of each other. And once you've hit about the 10 to 14 day mark after the second dose, is when you've built up to about your 93 to 95% immunity rate or efficacy. For Janssen, it's a little bit lower, but still good category. It's a one-shot series. It's made a little bit different. I'll back up a little bit. Pfizer and Moderna are synthetically made vaccinations. So, of course, there's no altering of your DNA. They're not live vaccines. They were made simply just for our body to mimic what that immunity process should look like when it starts. So it's enough for us to recognize that, enough for us to know, okay, hey, something's here already with COVID. let's start backing you away if you come in contact with it. That's essentially what it is in layman's terms. The Janssen or the Johnson & Johnson is a little bit different. It has a small protein of a virus, but not live. So essentially, it's called a viral vector vaccine. It's composed a little bit different, which is why it can be given in one shot. And it has about a high 70 percentile efficacy or immunity rate, rather. That one the same, one shot, about 10 to 14 days after is when you build full immunity.
So when you say you build full immunity, explain that to our
Sure.
audience.
The process that everyone has been so fearful of, also thanks to social media at times, is side effects, feeling like they've gotten COVID from the vaccine.
Right.
So one of the things that actually occurs with an immunity process or building antibodies in your body is the body can react in different ways. Sometimes you'll hear the stronger response, sometimes the sicker some people got for that day or two after that second dose. It's building even stronger immunity within your body. The body takes a little bit of time to just say, hey, this lives here. Let's start building and mimicking. That way, if COVID were to ever appear near you, essentially, it's going to say, okay, let's back up. COVID already lives here. Or, for instance, if you do come in contact with it, it's still possible to contract COVID while you've had the vaccine. But the ultimate goal, just like any other vaccine, is to minimize the side effects or the symptoms that you have. So you have seen on TV where people have still tested positive after getting their COVID vaccine. Some, they were actually exposed before that 10 to 14 day time frame after the second dose. And that's when they built that highest immunity, but they've already been exposed. So the body really didn't have enough time to react and build that wall up. So that's okay. They can still build it over time, but it just wasn't fast enough to beat the punch with that first test. Or you have some people who will get it again after the shot and not even know they have it, because it's deadened down a lot of those side effects where some people will be hospitalized, respiratory issues, bronchitis, pneumonia, and that's a lot of times what has caused the critical illnesses with COVID are the side effects from it.
Okay.
Yep.
So one of the questions I would like to ask is,
Sure.
what are some of the well, you said some of the side effects already of the vaccine, but what are some of the risks and benefits that are associated with taking the vaccine?
Well, most people should really suggest or discuss with their doctor first if you have any kind of medical history, severe allergies, more so severe medication allergies, not necessarily seasonal allergies. Let me make that clear. Those people who have diabetes, heart issues, respiratory issues, COPD, CHF, for the most part, those physicians have been strongly encouraging people of those backgrounds to get their vaccine, just because of the higher risk of demise or critical illness when those background issues come into play with COVID. You never really know when something lying dormant in your body or the genetic makeup of your body is just going to say, not this time. We don't want to have to worry about that issue if we're able to take the vaccine. Right now, the United States has purchased over 1 billion vaccine doses, trying to make sure that most of the adult population greater than 16 is able to get the vaccine. It's not going to be for everybody. It's going to be times where it's contraindicated or opposed by people because of their medical background, and that's okay. That's essentially where the term herd immunity comes into play. Right. If we're able to get enough people vaccinated, that 5 to 7% of the population who can't get it because of issues, it'll be a lot less likely for them to get it once the rest of the population has been exposed to the vaccine. For the most part, they don't know yet how long your vaccination dosage will last. They really need a lot more data right now. Generally, like we'll say with the flu, we know that's yearly around the same time frame, your October to March time frame. They don't know yet, just because we haven't been testing it enough to see how long those antibodies and immunity will last. They have had occasional false antibodies or false positive come up for people after vaccines, even though it's a messenger RNA composition. Sometimes some testing at some particular facilities are strong enough where they can pick up just a little bit that it's there, it's been there. So those are also some things where people have said, oh, I've gotten COVID after. You are allowed to get the vaccination and encouraged if you also have had COVID. As I mentioned earlier, the antibodies generally only last up to 90 days. There's tons of people walking around today that will never build antibodies from COVID. It just depends on your body. And in that case, about 3 months later, you can actually contract COVID again. It's not as high percentage, but it's actually possible. So that's why if you have had it and it's been greater than 90 days and you haven't been vaccinated, they're suggesting that you do try to take one of those three.
Okay, that's good information. So one of the questions that I was asked to ask you was, there have been talks around children being vaccinated, and if they did get vaccinated, it could cause them to be sterile. Could you give us some more information about that? Is it true, false, and should parents be concerned?
Right now, it's not a concern because, for one, it's not even being offered for the age of less than 16. There's a gap there for a reason. The clinical trials they've done have been on teenagers and higher, adults, 65 and under, 55 and under groups. They've done all races, but they have not done the testing officially on anyone younger than that age range.
Okay.
So I can't really say yes or no that could ever be the case. We never know what composition is made up within vaccines, but for right now, it's contraindicated for that age range, just because they want to be safe, just like with other vaccines. Make sure they're testing it well across all populations, just to be able to say, okay, we've done enough testing, we've seen enough side effects, it's okay, let's proceed.
Right, right. And then what about pregnant women? Should pregnant women be concerned? Is there a higher risk for them and for their baby if they did get vaccinated?
That's actually something that some physicians, depending upon the risk versus benefit, the jobs they have, some have actually allowed them to get it depending on the term. What they've actually just shown is that if a woman, say, is just delivered, she's actually able to transmit some of those antibodies through breast milk if she is able to get the vaccine to her infant or her nursing child instead. So they found some other ways to kind of get it done. But right now, majority of the physicians are saying no, unless it's a big risk factor for them.
Okay. So, so what you're saying today, we should not be afraid to take the vaccine, and you do encourage us to take the vaccine.
I would. Everybody has to look at their individual circumstances. What may affect one way may affect another. I can't say after my second dose of Pfizer vaccine, for me having a strong history and still being treated daily for COVID symptoms, I have long haulers. My body reacted differently. My mother, my siblings, my husband, a lot of them had nothing but body aches, headache for a day or two. The common things are flu-like symptoms, joint aches, body aches, headaches, because it's just essentially building that immune response in your body. Some people have nothing. Some people have nothing after the first dose. Some people have mainly their symptoms after the second dose. All depends upon your body. But actually having those symptoms for about a day to 2 days is actually common. It's not, oh, I've been poisoned. It's not, oh, I've been given COVID, I'm going to be sick now. That's one of the things that many physicians are just trying to dispel, that, okay, sometimes the stronger the response, which may not feel too fun, is actually a better thing for your body, because you're going to find those people who have built even stronger antibodies and immunity to COVID.
Okay. So life after COVID, there are also a lot of people who reports extreme fatigue, just a difficulty, a lot of brain fog, trying to figure out and get their life back on track. Have you heard of any of that? And do you believe that any of that is associated with side effects from COVID?
All the above. I experience some of that every day. Some we like to be a little bit more forthcoming from. Some we can just say is just as we age and we tend to be a little bit forgetful. But it is true. They actually have long haulers groups, and long haulers basically are those people who have tested in the past for COVID, tested positive, and they still experience symptoms long after they're no longer positive. For instance, I'll be transparent with myself. I have daily mild chest pain, headaches, shortness of breath, um, going up and down stairs where it used to not be a problem as a 35-year-old female that was fairly in shape. It's a task. You have to take a break sometimes after. So there are some life modifications some people have. Some people are permanently on oxygen. Some people have had to come out of work altogether, file for disability. Some of those people have found that even though they didn't have certain symptoms in the beginning, COVID can cause damage to your body enough where over time it starts to wear a little bit more. And some people had delayed effects. Some people did not have pneumonia until a month or two after their COVID diagnosis. So everybody's situation is different. We don't want to scare everyone and say, hey, everybody who tests positive for COVID is going to end up in the hospital and die. But we want to have that mindset sometimes that you may not, but carrying it to your loved one or your child or your grandmother that you may be caring for in the evenings may end up being that way. So if we have that notion where we're always thinking about the next person, which is why you've seen that sticker sometimes with people who've gotten their vaccine. I got this for my grandmother. I got this for my elderly mom with MS. It's because we want to make sure that even though we may be fine, transmitting it to them may ultimately cost their life.
Right, right. Wow. Yeah, that's very special because, just thinking about at church Sunday, how many people, elderly people, who have fought or have fought so long, so hard, against diabetes, dialysis, high blood pressure, whatever it might have been. Some that were doing well and only to be taken out by COVID. It was just like a slap in the face. And I was like, wow, you
Yes,
know,
ma'am.
they didn't go out there and get COVID. They were home and someone brought COVID to them. And now, they're no longer with us. So,
Yes,
I
ma'am.
do pause in their remembrance,
Yes.
their honor. I absolutely love their life, for being survivors, for fighting as long and as hard as they did. And I hate that they were taken out by COVID. And I do pray for their family members and loved ones. Um, wow. Is there anything else that you want to share that I might not have asked as it relates to the coronavirus and the vaccine?
Um, just continue to think about it. If you've had some reservations in the past, you never know when your bravery of taking that step to get the vaccination can show the next person. Some people are so strong and just brave every day, but they are just sweating bullets behind the scenes because they're afraid of, okay, am I going to get COVID? They're still experiencing those, things they're hearing on social media or what their friends are saying. Be mindful of the things you post or do your own research. A lot of times your physician is the best one to help guide you with that decision. Although I was still ill, my physicians were, no, you need to get it. You need to get it because next time you do contract it, it could kill you this time. And
Mm-hmm.
some are being honest with their patients and saying, hey, it takes a different toll. There are variants, unfortunately, out here right now. And that's another factor of why we don't really know how long the COVID vaccines will last before we may need boosters, just because we're going to need a little bit of boost with those being, different variants from different states around the world have come to North Carolina. Most of the vaccines have shown resistance to them or some immunity. So for the most part, we should be fairly okay with getting the vaccines that are available now. But at some point, just like the kids do in school, they'll need boosters to
Mm-hmm.
just reintroduce it to the body and just make sure the body knows, okay, hey, let's continue to fight, whether it's 6 months, whether it's yearly, until we really get this thing down a little bit.
So the variants that are here in North Carolina,
Mhm.
I haven't heard much about them. As a matter of fact, I used to look at COVID so much and the election and all that different stuff. I haven't studied as much about the variants. So could you talk to us more about those variants
Sure.
and how can we protect ourselves? Is it the same thing? The washing of the hands, the wearing a mask, and the social distancing. Talk to us more.
Absolutely. Just like any other infectious disease, flu, anything, although we haven't heard much about the flu for the last year, it seems.
Right.
Um, that's our biggest factors there. Washing hands. Just being mindful of whom you're around. I know it's seasonal allergy time frame, so you don't want to look at everybody like, oh, you have COVID because they have watery eyes and a sneeze. But
Right. Mm-hmm.
just being mindful, if you still socially distance, you're still wearing your mask. That's some things that'll still help dispel it as well. Basically, a variance is just a slightly different composition of the strain of COVID. Our testing have been set upon the SARS-CoV-2 that we have right now. And most of the time, the testing will still pick up on some of those variants, but some won't. They actually require a little bit more in-depth testing to determine why this medication isn't working for what we think is the regular COVID-19 we're used to in North Carolina. So that's where it just helps with some of the research that's going on with it. Being truthful when you're going and you're doing your vaccine questionnaires, they're going to ask you, have you had COVID within a certain period of time? Have you had fever or chills within the last so many days? Have you been around anyone you think possibly may have had it? You may miss that appointment because you're being honest, but there's a purpose for being honest with that. If you're already exposed to COVID and you introduce this level of immunity from the vaccination, sometimes you can cause more harm than good. It's better to be honest, better to be truthful,
Right.
and all they're going to do is just give you another appointment date. Yes, I actually was around someone. I'm feeling fine, but at the end of the day, you may just be developing symptoms, underlining symptoms, and they may not show until 2 days after you've already received your vaccine.
Okay.
So just
I
want to
do
be mindful of that.
I do have another question, and that question is if they've had the vaccine,
Mhm.
do they have to still wear masks?
Yes. So, just as I mentioned before, the vaccine is helping you build immunity, but not 100% of you'll never get COVID. One of the things is you may not have a response if you contract COVID, but you can actually still spread it to others that have not had the vaccine themselves. Right now, the CDC guidance is if you are around small groups of others whom have actually been vaccinated and their 2-week period has been up, they will allow that. So it may be your grandmother, your mother, your father, your aunt in a small setting. Everybody's been vaccinated. It's been 2 weeks. You're okay to go in with no mask as long as no one is showing any symptoms.
Okay. Another question.
Sure.
The viewer wants to know what are some of the things that you recommend they take if they do have COVID? They've heard a lot about
Sure.
they've heard a lot about
Supplements and stuff.
medications, yeah. So they want to know what are some of the things that you recommend they take and do.
Some of the basic regimens that myself, my physicians have encouraged, your vitamin C's. Vitamin C's have been a big factor. Your some of your multivitamins that have your calcium, zinc, and your magnesium within a combo. A lot of these you can get them from Walmart, Dollar General, your CVS. Those are some big factors that can help you build up a little bit of natural immunity.
Mm-hmm.
Of course, you can get a good bit of vitamin C and some of those within your food, but sometimes you need that higher concentration for that boost factor. Good multivitamins, eating your fruits and veggies daily will always help with that.
Okay. So the person said elderberry. I knew this was what we were talking about. I was
I
just
take it daily.
I
Yes.
wait for them to respond back because I took the elderberry as well. It's
Yes.
good. And I also believe in the power of the elderberry.
Yes. I
Um,
take it daily.
Wow. So that's some good information, Angelique.
Mhm.
If you could please just, for those individuals who are just coming on or who will
Sure.
view this later, if you would just give us a recap, go over some of the signs and symptoms of the coronavirus, and also talk to us about the three different, the three main vaccines that are out there, and what do you suggest? Do you suggest that the Moderna, the Johnson and Johnson, or the Pfizer vaccine for us to take?
Honestly, anyone with a level head in the medical field is going to say go for the one you can get an appointment for. Um, most places, I'm just not going to beat around the bush. That's one of the things you can wait for forever sometimes on certain brands. They're all built essentially the same way. The Pfizer and the Moderna virus are messenger RNA synthetic style vaccines that were composed. So those are going to have about a 93 to 95% efficacy rate after about 2 weeks after your second shot. You do build a little bit of immunity in the beginning, but don't let your guard down. We've seen a lot of people who will get their first shot. Oh, I'm vaccinated. I'm great. Come back with COVID and can't figure out why. Oh, the vaccine gave me COVID. You're only building about 40 to 50% immunity or efficacy after that first shot. And that's 12 days after your first shot. 3 weeks in between each shot is when you'll come back for the second. Sometimes it's up to 4 weeks, depending on the appointments. And about 14 days after your second dose, or either 14 days after your one-time dose with Johnson & Johnson, is when you have technically been fully vaccinated. You have to give the body time enough to respond. For most people, that response from the vaccine, or side effects, as people have been eagerly saying on social media, it's normally seen the first through the third day after the dose. Generally, if you're going to have any symptoms, your body aches, headaches, fever, those are the first day to about the third day. Everybody's different. It doesn't mean you've had COVID in the past necessarily. It just means your body is responding a little bit stronger. And most physicians will tell you the stronger the response, they equate with a stronger immunity build in your body.
Angelique, I have another viewer with a question.
Sure.
The viewer is saying that, they're going through emotionally. They were glad that you made some of the comments that you made a few minutes ago. What can they do to help their emotional health? Yeah.
Talk it out. Sometimes people view the opinions of their PCP strongly, and with guidance with that of their medical background, whether or not they should actually take the vaccine. That's something that helps people. Some of those intimate conversations with your physicians or the nurse practitioners in the office dispel some of those rumors. It's easy because some of those who are never even considering taking the vaccine are the ones who are encouraging others to not take them, until somewhere down the line in their family, ultimately, they may have had a demise from COVID. And sometimes it changes their perception of this vaccine. I know it's been out there that, oh, it's come out so fast. Why should we take it?
Right.
Believe it or not, this is the average speed or length of time for COVID vaccines to actually be manufactured and distributed. It's no different. Just been talked about a little bit more than our measles, our polios, all those other vaccines. They're all the same. That's one of the reasons why they made sure, if you ever listen to Dr. Fauci speak, they made sure that our Black and Brown community were even more populated in a lot of the clinical trials, to make sure that different genetic backgrounds, ethnicities were all in these trials, because it's public knowledge for you to be able to go and say, hey, 500,000 people of non-Hispanic descent or 500,000 people of African-American descent were in these trials. These were the common side effects. These were the symptoms they had. That way we can see someone who looks like me took it, and this is how they responded.
Right. Wow. Go ahead.
I was going to say the second person could actually be taking someone to the side that you trust. A lot of people have been brave to post their cards or brave to post them getting pictures of shots. A lot of facilities are encouraging that, just to help die down a lot of these fears and emotions from it. There's always going to be people, because they've seen a YouTube video of someone passing out while they got the shot, to say, oh my gosh, I'm going to pass out when I get there. I'm not going to show up, which is how a lot of second dose vaccines end up getting canceled, because of that fear. So you just want to use good resources, research. If you found that your neighbor Joe Blow was scheduled to get it and you trust their opinion, go and talk to them in an intimate setting, or talk to them over the phone and say, hey, you already got it. You took it about 3 weeks ago. What was your response? And when you start getting calls like that and they're transparent, they'll tell you, well, I had a headache, or I was feeling a little cruddy for a day or two, but I came out of it and I feel good because I'm vaccinated and I feel that I can protect my family. That builds a little bit of level of confidence. And most people have decided to change and go back and get it. Right now, they're trying to make sure there's enough appointments available, but it does differ. A lot of places require an appointment, and that's how they know to bring in so many doses. So just be mindful. If you're one of those people who know you don't want to go back and get the second dose and you're leery of it, cancel ahead of time so someone else can benefit from that vaccine that's sitting out there, because those doses are only good at room temperature for so many hours that day.
Right. Awesome. So what are some of the facilities or resources that you have that you can recommend individuals to go to for vaccination? I know Walmart is one of the places.
Your public health department, most of those per counties are having a listing of My Vaccine Finder. It will allow you to just simply put in your zip code, and it will basically just shoot out all of the locations: Walgreens, Walmarts, county health departments, some school stadiums, anything that actually has appointments. You can go and sign up for all you want, honestly. Sometimes people will have signed up for 3 different places, waiting lists and such, and whichever one dinged the fastest or emailed the fastest, they took it. Also be mindful of where some local clinics are. There are a lot of same day vaccination clinics, different places, some Saturdays, Sundays, at churches. Be mindful and share that information, because a lot of times that's when those people who are working during the week, or they just don't have that patience to sit on that hotline for 30, 40 minutes scheduling an appointment. They know they'll just go and come, show up early to the church or show up early to the vaccination clinic, and there they are. Once you've gotten your first dose, that is a good thing, because from there, they will make sure you're scheduled before you leave for that second dose. So you'll never be left of, I got my first, but I don't know how I'm going to get my second. They make sure of that. And that's how they're able to schedule for how many doses they need in the future.
Okay. Have another question.
Sure.
The viewer wants to know, what does the vaccination process look like?
So based off of those questions I mentioned, I'll mention again. They'll generally ask, have you had COVID within the last 30 days? Have you actually had any infectious symptoms such as fever, chills, body aches over the last so many days? I think it's up to 14 days or what they'll ask. And then they'll lastly ask you, have you been exposed to anyone that has tested positive over the last so many days? Once you go through that piece there, if you answer no to those questions, they'll go ahead and let you sign up. Most places actually don't even require a photo ID unless it looks as if they may be younger and they need to just make sure they're over the age of 16. But literally you go, you answer those questions again on the spot. No blood pressure, none of that is taken. I don't think any are even taking temperature checks. They're essentially just taking your word for it. When you go in, they'll go ahead, do your place card, give you your vaccination, and they generally will watch you for about 15 minutes after. For the most part, any anaphylaxis or serious reaction will normally occur during that time frame. So they'll have some form of clinical personnel to watch you for 15 minutes, and then you can go. They'll go ahead and schedule your second appointment. You'll know the date and the time to show back up. You do the same thing again. They're going to ask you those same questions again. Get your second appointment, get your shot. You take that same card back with you, and you'll be done. The same process, 15 minutes again. And like I said, about 14 days after that second dose is where you're truly fully vaccinated, and they predict that full immunity process has already happened in your body.
Okay.
Yep.
Angelique, one viewer wants to know, is it safer to go in a clinic or is it safer to go through the drive-thrus?
A lot of places to kind of keep down on germs, they've been doing a lot of the drive-thrus. Less exposure for the workers. Most of the time they're outside. The same way you'll see some Walgreens now or allowing you to swab your own COVID test versus a nurse coming out. It's less exposure. The best is what a lot of places are doing. Elements, setup, facility, setup may not always be the best. It's honestly whatever you can get. Right now, this phase, there's sometimes have been enough doses, sometimes there hasn't been. So it's one of those things where you're on two wheels smoking. If you can get an appointment, even if you have to walk up outside in the rain under a tent, go for it, because that's closer to the time frame where you can be vaccinated and you can start protecting yourself and others.
Thank you so much. I appreciate that.
Sure.
If we have any more questions. Okay, I don't have any over there. And I don't have any over here. Angelique, we really want to thank you for, taking this time to come and share this information with us. Is very vital, not to just to our help, but to those around us. The United States, the numbers, I've seen them. I watched them again today. They are decreasing, and there's been a lot of people who passed from the COVID virus. But when you look at the number of survivors, there are more people who survived than died. And I'm so glad about that. So tonight, Angelique is encouraging us to, still make sure that we wear our mask, wash our hands, social distance, beware of any signs and symptoms that we may have. that could be related to COVID-19. If you feel that you may have any signs and symptoms of COVID-19 or what we know as the coronavirus, please make sure that you go to your doctor, you get checked out.
Yes.
And one of the things that I've heard them recommend too is stop trying to self-medicate. A lot of people have tried to self-medicate. Please, if you have some of the signs and symptoms that she talked about tonight,
Mhm.
please make sure that you go get checked out. One of the questions that were asked about little children, can they contract the coronavirus? And the answer is yes. And you need to make sure that you protect them as much as possible as well. There are a few vaccines that are out there. We discussed those as well. And one of the advices that she gave us tonight was to make sure that you talk to your own primary care physician and see what he or she recommends for you to
Mhm.
do in terms of vaccination, and also which vaccination that you should take. Ultimately, the choice is yours. But what we want you to do tonight is don't wait any longer, vaccinate. So don't wait, vaccinate. Angelique, I'm going to give you this time to share any more
Sure.
information or any questions that you may have for me before we leave off tonight.
Just two quick things. Basically, what you just mentioned. Some people, as you mentioned, will try to self medicate, whether it's via insurance issues, whether it's the entire phobia or fear of everybody's going to think I have COVID. Even if I'm just walking in the door with flu, I don't
Right.
want everyone to know. If you feel that way, use a buddy system. Some people have often told their mother or their grandmother or their sister or their cousin, hey, this is day one. This is what I'm starting to feel like. Just telling you in case I may change. COVID has one of those um, compositions where it can change from day one to day three drastically. So sometimes it helps to have that background information where, for whatever reason, you may not even be able to speak for yourself at that point. You may be that ill. Your mom can come and say, hey, she said she was having this headache. She said she was having this. That's one of the ways we really can start looking at COVID a little bit closer and seeing, okay, is it COVID? Can we treat it for this? Is it something else? It really just helps to narrow those things down for the physicians if you actually have to go and get any follow-up care, and just make sure they're giving you the best they can. It's like a person coming in with 50 symptoms sometimes, and the doctor doesn't know to start from A to Z with what to treat. Being more specific and with time frames is important when it comes to COVID. Um, Also, with wearing masks, two facts. Just to make sure everyone is aware, COVID is primarily respiratory droplets, coughing, sneezing. However, it can also be contact based because a lot of people will rub their nose when it's running, rub their eyes, any kind of mucus membrane is where it can spread from. So we want to make sure, I know sometimes it's hard to breathe behind these things, but it's not going to work if we don't wear it above our nose. If we wear it over our mouth and still leave our nose exposed, you still run the risk of getting those same germs. And you're like, oh my gosh, I wear my mask every day, but you have to make sure you're wearing it properly. Sometimes a seal test. Some of the masks they have on the market we bought from different stores, Walgreens, Amazon. Sometimes we have to change those out. They're really not meant to wear day in and day out and give that same seal, that same bit of protection. If when you're breathing, your glasses are still fogging up a lot, or it feels like you have air coming out the sides of it, we may need a new mask. Also, to be mindful of how masks work. They're keeping those germs out away from getting inside to you, meaning they do need to be washed. So you'll see some people who are just wearing the same cute little lion or same emblem they have, but they have not washed it since COVID started last March.
Mm-hmm.
You're defeating the purpose. Even if you have come in contact with something even as simple as a cold, you have to remember you're still breathing in those same germs in that mask. So just be mindful of it. Some people will just go and get the disposable blue or black mask if it's easier. If you are in a setting where you are concerned for exposure, it's okay to double mask. Most of us in the medical field actually do that because that just gives a better barrier. So if you happen to be out somewhere to function and you can't social distance as much, it's okay to wear a fabric and also the surgical mask together just for extra barrier protection.
Okay. Are there any particular mask that you recommend? The surgical mask, the cloth mask? I see a lot of people wear the plastic shields. What do you recommend?
A lot of them go hand in hand. So the plastic shields are great. Some people will have them more for kids because they don't like the mask just being directly over their face or snug. They're better when they're worn in conjunction with the mask
Hmm.
because it's still an open area up under. Person that has the mask on can have COVID. All they're doing is shooting it down to the ground or shooting it down where others are going to walk into it. So it's just an extra layer that some people are doing. If they have lipstick on, some people have done that, or events where they wanted their face to show. So it's temporary. It's not as effective, but it's better than nothing.
Right.
Mask, surgical mask, you just have to make sure they're sealed around the bridge of your nose. Some masks are going to be too big or too small for some. We just have to be mindful of a look in the mirror. If we can do this and we can still feel the air coming out, we need a different size mask.
Okay. One viewer asks, Ms. Angelique, how do you take care of maskne, that acne that comes with wearing mask?
It helps by washing. It helps by changing them out often. Sweat builds up some of that moisture from us talking, especially if you're a person who has to talk up under it all day long. That moisture will build there. Sometimes it's just trial and error. You'll notice certain brands work better than others. If you're one of those people who have sensitive skin, some of those will wear the cloth barriers against their skin and wear the actual surgical mask on top of it. That may be the piece sometimes that's irritating for them.
Right.
And that
Right.
seems to work better.
Right. Okay. Well, Miss Angelique, if there's nothing else that you would like to share, again, I would
That's
like
it.
to say thank you so much for joining Moments of Motivation with Michelle.
Yeah.
You've given us a lot of information, and I hope and pray that a lot of individuals, like, tag, and
Yes.
share this video so that our communities can be informed about, number one, coronavirus. It is still out there.
Yes.
You can
Yes.
still contract it. You can still pass it. How can we protect ourselves and others from the virus? What can we do if we do get the virus? And then lastly, there's a vaccination out there, a vaccine out there that
Mhm.
can help us. May not be 100% effective, but at the end of the day, like she's saying, we can do all that we can to build our
Yes.
immunity. There are a few vaccines that we discussed today, Pfizer, Moderna, as well as Johnson& and Johnson. And what's the name of it you said, Johnson& and
It's
Johnson?
it's it's labeled Jansen.
Janssen.
Mhm.
And you have that choice to choose which ones that you want to take. We just don't want you to wait any longer. We don't do want you to vaccinate. And prior to vaccinating, talk to your doctor, your primary care physician. Let him or her make recommendations for you
Mhm.
so that they will, so you know which one is best for you to take as well.
That's right.
So we thank you for joining us on Facebook, on
Thank
YouTube.
you, everybody.
Um, Thank you. Please tag, and share this video. We hope and pray that you all had a wonderful, wonderful Easter break. I know some people had their Easter break last week. Some are having their Easter break this
Mhm.
week. For whenever it is or was, we hope that you had a good time or that you are having a great time. And also, we ask you to please go over to YouTube and like and subscribe to my YouTube
Yes.
channel, Moments of Motivation with Michelle. Today, we're sitting down with this beautiful young lady, Miss Angelique Spencer, who is a RN. She was on both sides of the fence as it relates to COVID-19. She is a nurse, taking care of patients, supervising nurses, and then she also contracted COVID-19. And she also is someone who's been vaccinated. So she was able
Yes.
to give us a wealth of information. You're hearing it from the horse's mouth, not just someone that's speculating, but someone who is a professional, and knows about COVID-19. So again, we thank you for joining us, and we hope to talk to you soon and bring you back again, Miss Angelique.
Sure will. Thanks,
All
everyone. Thanks for
right.
having me, Michelle.
Oh, you're so welcome, and you have a great night.
You too. Take care,
Okay.
everyone.